Hi Arpit, this is Dr. Harpreet Singh and I represent Team Conceptual Orthopedics. So,
Hello,
Dr.
sir.
Arpit, I would like to congratulate you on your exam result, DNB exam.
Thank you, sir.
So, tell me, Arpit, for the help of your juniors and other friends, tell me how did you go about preparation of your DNB practical exam?
Sir, actually, I've already done my MS, and I've been a subscriber with Conceptual Orthopedics from 2021.
Okay.
So I around 6 to 8 months during my third year, I used the app, and but I could not justify it using at that time. So I passed my MS at that time, but slowly I got more oriented to the app, and then I once gave my exam in April last year, but I could not. I got a score of 188 out of 400 that time. I gave the exam this time in April, and I got in theory I got 222 out of 400. So September, uh, I had to give my practicals. So sir, I was preparing. So most of the things were similar to my MS exam, apart from the OSCE part. So for that, the I had attended the course that was in the mid September also, just before the exams. So that gave me a very good idea of how to attempt, because things we were studying in the already we were studying in the app from our books, but it was more important. I thought that the things that were given, the guidance that was given on how to attempt the OSCE was, I think, the game changer, because in the mock test that was conducted offline when we had visited there, there were a lot of things that we had done wrong. That we had not attempted the question in sequence, particular parts, or we had written on the back side of the paper. So I got around, I think, 43 in that exam. So I thought I could score 5 or 6 marks more at least if I had attempted on the same side, or written more clearly. As it was mentioned in that course that we should be focusing on key points and not writing long answers. So that was very useful, and I wanted to attempt the DNB exam just for to get a hold that where do I stand even after completing MS, and because I could see that people were doing very well when I used to attend the live lectures in the app also. So that was a big motivation that I should attempt this and get an idea that where do I stand. So I got a I think decent marks of 168 I scored in the practicals, and so I'm expecting that I scored more than 50% in OSCE individually also. So some questions were difficult, but I thought that the approach was my approach was right. So the brain, I think it got acclimatized that how I should be attempting the question at least. So, because if there were things that I had not seen completely, so that was the question that I knew I had to write very. So I could manage the allotted time that was there. I could very well complete it within that time. I was not wasting any time, and short and to the point answers I was giving. And like the one gynae question, Shailesh Pai sir showed in the class that the answer key and um, the question, it just depends on the typical word. So that was, I think, that was very helpful for the exam point of view. Rest, I thought that the practical exam was similar to my MS exam, and that was similar to that were all, I think, the basics. The classes on splints and orthosis prosthesis that Ankit sir took was very useful at the end, because he told us some tips to answer in a particular way. So that was it. And in all, sir, I was following post my MS. I had used the app more. I had also told my juniors to use it, but I still feel that I have only used 10% of the app, the material that is available on the app. And apart from the books also, so when the conceptual people asked me to call the for the ask for the result, so they said that sir आप subscriber भी हो क्या? हमने कहा कि I told them that I took a 4 year subscription at the end of my third year, because I knew I will be using this app because first time in 2021 when the co-PG course was happening, that was the first time I attended the conceptual. So it has been very. It is still the go-to thing. If I have to read something, I have to find something that. So I first go through the app and see that what all is given.
Great to hear that we have been able to make a difference for our students. Arpit, where are you working right now, and where did you do your MS from?
I did my MS from Dehradun, Shri Mahendra Hospital and Guru Ram Rai Medical College. I worked as SRA and recently I got promoted to the post of assistant professor. I'm currently working here only, and I have a keen interest in arthroscopy, so I've recently started doing arthroscopy here only. And sir, I recently attended the conference in Delhi also. I met you there in the shoulder arthroscopy course also, sir. So you were a table instructor there also. So that is where I'm currently working there also.
Okay. What do your parents do, Arpit?
So my
And their names, please.
father name is Arun Kumar Vishnoi and my mother's name is Poonam Vishnoi, and my parents own a nursery, the plants nursery. So that is a business, and I'm a first generation doctor. So they're very happy that I even attempted the DNB. It's a big thing.
Great, great. अपने parents का नाम रोशन करो आप और आगे बढ़ो. Wishing you all the best for your future endeavors. And very happy to hear that we were able to make a difference in your education.
Yes, sir. And I have a plan to even further the subscription when it ends, because I think it is helping in my day-to-day practice also, sir.
Thanks, Arpit. Thanks for your time. And we'll hope that we'll keep in touch. And
Yes, sir, definitely, sir.
in your career. Thank you, Arpit.
Thank you, sir. Thank you, sir.